Maybe we could start if you could tell us a bit about yourself and why you got interested in the field of addiction problems.
Yes, thank you. So, yeah, well, I currently am a professor in substance use at the University of Stirling, but my interest really started a long time ago when I was a teenager working in a community pharmacy, and I could see in a community where there was a lot of substance use and a lot of people using drugs at that time. So this was in the 80s, where the drug problem in Glasgow
Mhm.
was particularly taking hold. It really was quite impactful on communities. So I think just observing that in those early days was what kind of piqued my interest in this area. And so when I went on to, I studied pharmacy and I studied public health and went into academia following that, I was really keen on looking into this area more with a view to looking at effective and evidence based, developing evidence based treatment and care systems.
Thank you. And do you think there's anything distinctive about the nature of addiction problems in Scotland?
Yes, we do seem to have some features, but and it's quite difficult to pin down. It's easy to say, oh, it's a complex thing, but
Hmm.
um, really to try to pick it apart a bit. I mean, it undoubtedly stemmed from that period in the 1980s where there were communities where there was de-industrialization, there was high levels of unemployment, and there was people who were taking up substances for a variety of reasons, and the heroin market um, increased and was available, and so that got people, quite a cohort of people, into using drugs in these in these communities. And once it had got entrenched in these communities, it starts to go down through generations because you start to get the more complex development of the more complex factors associated with addiction, such as being involved in criminal activity, then having a um, having a criminal record, homelessness or problems with housing, and also people having children taken away, and also children having adverse childhood experiences because they're being potentially exposed to a whole kind of range of things within their environment. So those things all got get start to play into propagating the problems, the really complex problems, and the complex trauma that we see as a result of addictions. Um, the other features in Scotland are, of course, the emergence of HIV in the 1980s, particularly in Edinburgh, and that was through the culture locally here around sharing injecting equipment, sharing needles, and that was a feature. Even within Scotland, it was a feature more in Edinburgh than other parts of the country. Um, and we also had a lot of prescribing in the general population of benzodiazepine type drugs. So that was for managing sleep and anxiety, and that spilled over into the drug using population. Um, so these factors kind of have come together and have been part of the kind of unique challenge that Scotland has. Um, Sometimes there's questions about, is there something in the Scottish psyche that's
Hmm.
predisposed us to
Hmm.
addiction and drug taking?
Hmm.
Um, and I think there is some. It's not been studied particularly well, but I think there is definitely some suggestions that there is something there about risk taking and enjoying that the kind of risk of taking substances and the highs and things that go along with it. But mixed up with all of that is the consequences that people face
Hmm.
when they do get sort of really drawn into substance use.
Hmm. Yeah, that's very interesting. And of course, I mean, I'm thinking about the novel and film Train Spotting,
Mm,
where the famous line about it's shite being Scottish.
mm.
I don't know what you think of that.
Yes, yes. Uh-huh. Train spotting's an interesting one. I mean, that, yeah, they did start to reflect on that, this sort of Scottish factor. Train spotting is interesting just because how it depicts, that group and that culture.
Hmm.
Um, and I've got quite mixed feelings about that. I think it's, I enjoyed watching the film personally, but or parts of it, but it, I think in the long term it's been kind of quite damaging and sort of played into the stigmatization of
Hmm.
people, particularly women and mothers.
Hmm.
With this scene
Yes.
where the baby dies, and which was horrific, but that has been really, really problematic. I
Hmm.
think
Hmm.
the consequences of that are that women who has problems with drug use and has children um, is really subject to a whole different level of stigmatization and risk of child being
Hmm.
taken away, not necessarily getting the support to be able to keep children. And the consequences of that, of course, are the guilt and the depression, and that predisposes women to overdose and to drug related deaths.
Hmm. Yeah, well, thank you. I think that's important points you're making there.
Yeah.
If we could move on, it's linked to the concept of decriminalisation.
Mm.
What are your views on that?
Yes, I mean, I am generally for decriminalisation. I mean, what we have, it's taken me a while because I've been in this field now for kind of 30 or so years, and I used to think if you decriminalise, more people will use drugs, and that in itself will bring more level
Mm.
of risk across the community. I have changed my thinking on this because more people are using drugs and um, are experiencing the consequences of that anyway. And by criminalising people, we're really just giving, stopping their. By criminalising people, we are minimising their opportunities to change and to break that cycle of the consequences of drug use. So the Misuse of Drugs Act, which dictates the law around this, is very rigid. Um, we have made some moves in Scotland to um, to minimise that, so that, for example, if somebody is found in possession of a small amount of illicit Class A substances like heroin or cocaine, they're both Class A drugs. In the past, they could be, according to the Misuse of Drugs Act, they could be liable to prosecution. But now we have a situation which is quite recent and very welcome, where there has been what's called a statement of prosecution policy, and the Lord Advocate, that's our legal main legal government advisor, has been able to say that it's not in the public interest for people in small amounts for personal use to be prosecuted. So that's positive, and it's kind of what you might say is de facto criminalisation. So um, it means that at least people who are maybe at the end of the chain of supply and are using substances themselves and not necessarily a risk to wider society, they at least will not be criminalised, and therefore impeded really from kind of everything that goes along with that criminalisation. It just stops people in treatment, stops people getting back into employment and reintegrating if they want to. So um, yeah, I would like to see the issue of decriminalisation being reviewed. I'd like to see the Misuse of Drugs Act at
Hmm.
UK
Hmm.
level being reviewed, because it feels that it's no longer fit for
Hmm.
purpose.
Hmm. And that kind of leads into the next question. What would you like to see change in our approach to the addiction problems, if anything?
Yes, well, I mean, so there's that aspect of decriminalisation, certainly, if that's something we could do at UK level. I think there's a lot we could do in terms of our management, our clinical management of people, and our service structure for people who have people who use substances. Um, Stigma is an issue, undoubtedly, that people feel, and I've mentioned a little bit about trauma and complex trauma, but that manifests itself quite strongly in how people interact with services, and certainly um, can play out that people also feel more stigmatized. They can feel unworthy of treatment. They can be more sensitive to being treated in a certain way. And there's undoubtedly some level of prejudice and even discrimination in our general, across our general medical um, type services, I'm afraid to say. So that still exists, and there's a lot of work to be done to
Hmm.
inform
Hmm.
really all medical and everyone in a kind of front facing role. It's not just doctors, obviously, it's
Hmm.
nurses
Hmm.
and pharmacists and receptionists and everyone who comes into contact with people who may use substances um, could benefit from what we call trauma informed training and trauma informed care, and understanding how people act and understanding the sensitivities around stigmatizing behaviour and discrimination, really, what is effectively discrimination against people who have a history of substance use.
Thank you. Looking ahead to the future, how would you see drug addiction problems or any addiction problems in Scotland in the future, in a few decades? How do you think it'll look? Difficult to answer,
Mm.
of course.
A few decades is a long way ahead, and I'm not.
Well, we'll make it nearer if you like.
Yeah, yeah. Well, I mean, things are changing quite rapidly now.
Mm-hmm.
So when the problem started, as we sort of referred back to the 80s, it was generally single drug use. It was heroin use that had a particular, pattern of overdose if people
Mm-hmm.
just took too much. Sometimes people would be using that with these benzodiazepine type drugs. Um, what's happened is there's less injecting heroin. There's a lot more drugs. The range of drugs that people use is wider, and the access to drugs is also easier. They're more abundant. They're cheaper, and so people are using more substances. So cocaine is a good example of that. Cocaine used to be known as an expensive drug in a certain kind of people using it in certain circumstances with money. It's no longer that the case that cocaine is very widely used across society, but it's also used in people who have a history um, of using drugs, and so that's a combination. So and we also have other drugs being used like pregabalin,
Mm-hmm.
which of course is widely prescribed also for managing certain types of pain. Um, and you'll find that polypharmacy is now starting to play into our um, risk in our drug death situation. So people may be prescribed certain drugs and also taking other drugs illicitly because they're available very freely on the market. Um, and it's that combination of substances that puts people at risk of a drug death. But the other aspect to this is that people are using substances often to self-medicate. Sometimes it's to get high and to sort of seek oblivion, and but sometimes people are using things to self-medicate. And because we're an internet culture now, you can buy drugs on the internet. People do, and a wider range of people in society are using internet sources of drugs, and they're using others, and they're sourcing, drugs like ketamine, for example. Um, that's becoming quite a common drug of use in younger age groups. So we're going to see changes in the patterns of drug use. There's going to be less heroin. There's going to be more substances, and that just brings with it, a lot of unknowns. But from a clinical perspective, it's also how do we best manage that? How do we best support people who've got into this polysubstance use where they're using several different drugs, and maybe also being prescribed drugs for other mental
Mm.
health conditions, pain, a common feature. So it's going to be quite complex, and I think making sure we have the clinical grounding and the evidence to help support how we respond and how we manage people um, is really important. So that does require investment in clinical research around this area. Um, and that's something that's been, missing really. There's not been sufficient clinical evidence development on how to manage these more complex problems.
Thank you. I was going to ask you if you could think of a personal example, without breaching any confidentiality, of course, that you've encountered in your clinical or academic life that's made you, that illustrates, you think, the challenges of addiction problems.
Yes, yeah. So I mean, I can maybe think of a couple of examples. Um, an example that somebody brought to me was this. This is to illustrate stigmatization of people who have people who use drugs. A woman who's been treated for her drug use. She was taking methadone. She was in treatment. She was doing well in treatment. She didn't have any relapses, and she got breast cancer. She went through breast cancer treatment, and she still managed to, not have any relapses. She did really well. But unfortunately, she then was looking for reconstruction, breast surgery reconstruction, and was told that's not available for people who smoke or use drugs. So, there's an example of discrimination, clear discrimination against somebody because of their substance use. And I think the implications of that for that individual are really quite potentially quite damaging. That really could destabilize her drug treatment, make her feel, of course, that she's been discriminated against, been stigmatized, and that's the kind of situation that challenges people and risks relapse. So yeah, it's thinking through some of these sort of situations and the possible implications on a people who might be quite doing well but quite fragile in their kind of recovery, and have been through a lot clearly. So that's one example. Other examples. So I'm involved in reviewing drug-related deaths and the circumstances of deaths. And something we do come across from time to time in cases is where people have been in hospital, admitted through A&E, maybe for respiratory conditions, very common, maybe some kind of deteriorating respiratory type situation. And there, once the substance use history becomes evident, there's been some cases where we felt people have been discharged, um, probably prematurely, probably before would be ideal for their kind of medical treatment. And although it's hard to evidence that, there is certainly a suspicion that may be related to their substance use. And we've had cases where people have gone on and died, whether it's directly related to that, but you do feel that that could be a factor. So that kind of potentially discriminating behaviour it does have implications for people and does increase the risk. So yeah, I think further education across our care, professional care providers would help to raise awareness of that and understand some of the more complex issues underneath and the potential consequences
Mhm.
of that type of situation.